Hello, welcome back to anatomy. We are on the muscular system, part one. And in this lesson, we're going to talk about muscles that move the arm. So your arm, very important limb. We use it to do all types of stuff, from carrying groceries, backpacks, to writing down our names, writing papers, cooking, lots of things. We do all types of things. And there are several muscles that move the arm or the humerus. We will focus on the prime movers, and the prime movers move the humerus at the shoulder joint. So we're going to be dealing with this area here. Muscles that move the arm are classified by whether they originate on the scapula, which is the shoulder blade, or not. Muscles that do not originate on the scapula are classified as axial muscles. Muscles that originate on the scapula are classified as scapular muscles. So if you can remember scapular muscles, if they're not originating on the scapula, they're not called scapular muscles. Pretty straightforward, but let's take a closer look at each of those muscles. The axial muscles are the pectoralis major and the latissimus dorsi, or your lats. Scapular muscles, these are originating on the scapula. They are the deltoid, the supraspinatus, infraspinatus, subscapularis, or subscapularis, and the Teres Major. Here's a diagram of those muscles. The pectoralis major, it flexes, adducts, and rotates the arm medially from the shoulder joint. So anytime you're moving or rotating your arm more forward, you can kind of feel your pectoralis major moving around, flexing. The origin is at the clavicle, sternum, costal cartilages of the upper ribs, while the insertion is the greater tubercle at lateral proximal end of the humerus. So remember, the origin is closer to where the muscle is attached, and then the insertion point is further away from your head, further away from your head. And then your lats, so on the back of your body, your latissimus dorsi extends, medially rotates, and adducts the arm at the shoulder joint. It's known as the swimmer's muscle because it moves your arm the way you perform a swimming stroke. So if you've ever swam before, when you're paddling or doing more of a swimmer's stroke, you'll be pulling the water in a motion that engages your latissimus dorsi. Your back is engaging, and you're pulling the water as you're swimming. So specifically, it pulls the arm downward and backward while rotating medially. And the origin point is the iliac crest in spines of sacral, lumbar, and lower thoracic vertebrae. Insertion, enter tubercular groove at lateral proximal end of humerus. deltoid, abducts arm, extends or flexes humerus at the shoulder joint. Origin, clavicle, acromion process, and spine of scapula. The insertion point, the deltoid tuberosity on lateral mid-region of the humerus. So origin, think they start at the scapula and then the insertion point is the humerus. So if you notice a pattern here, all the insertions are the humerus, right? Near the humerus. So it'll originate at the scapula and then end with the humerus or some part of the humerus. The supraspinatus abducts the arm and laterally rotates the humerus at the shoulder joint. It originates at the supraspinous fossa of scapula. The insertion point is the greater tubercle of lateral proximal end of the humerus. The infraspinatus rotates the arm laterally at the shoulder joint. Infraspinous fossa of scapula is where it originates, the origin, and then the insertion point is the greater tubercle at lateral proximal end of the humerus. The subscapularis rotates the arm medially at shoulder joint. Origin is the subscapular fossa of scapula. The insertion point is the lesser tubercle of the humerus. Teres Major extends and adducts the arm at shoulder joint. The origin, the inferior angle and lateral border of scapula. The insertion, the lateral proximal end of humerus. The teres minor rotates your arm laterally at the shoulder joint. And then its origin is at the lateral border of the scapula. Insertion, the lower portion of greater tubercle at lateral proximal end of humerus, of the humerus. So at the shoulder joint, the arm is able to move in several different ways. So if you try moving your arm the way these words are describing, it can help you remember. So abduction, moving the arm away from the body. So have your arm by your side and then move your arm away from the body. That's abduction. Adduction is moving the arm in towards your body. So move your arm closer to your body. Adduction. Extension, well, you're extending or straightening the arm. Hyperextension, that's extending beyond the normal limits. That's you don't want to hyperextend anything. Flexion, that's when you're bending a joint or a limb. Lateral rotation, rotating away from the center of the body. So have your hands sort of together in front of you, like sort of in like a prayer pose, and then let go of your hands and then rotate them outward. That's so you're like you got your hands in a prayer motion, and then you like bring them out as if you were going to give someone a hug. That's rotating away from the center of the body. And then medial rotation is rotating towards the center of the body. So that's like you're trying to give someone a hug, and then you put your hands together. That's medial rotation. So try to get active. Try to move your arms in the way these words are describing the movement. And maybe that'll help you remember what's happening with the shoulder joint movement. So here we get some pictures. Abduction of the shoulder joint is performed by the deltoid and the supraspinatus. So he's raising his arm upward and using these muscles to do it. And then adduction would be this person putting the arm back down. And that uses these other muscles. Extension at the shoulder joint is performed by the lats, the pecs, the Teres Major, and the deltoid. So you see how he's extending. That is how that is achieved with these muscles. Hyperextension at the shoulder joint, that'll be the lats and the Teres Major. That can put your shoulder in a compromising position. It may lead to injury or make it easier to injure your shoulder joint. So you kind of want to stay away from that. Flexion at the shoulder joint is performed by the deltoid and the pecs. Lateral rotation is performed by the infraspinatus teres minor. So you see how his arm's down, and then he's rotating the hand away. And then same position, but he's rotating his hand towards his body. And that uses these muscles to do it. The muscles that act on the anterior side of the humerus include the deltoid, the anterior and medial heads, the pectoralis major, the latissimus dorsi, but from the back, the teres major from the back, and the subscapularis. On the posterior side of the humerus, the muscles acting are the deltoid, the posterior head, so the back head of your deltoid, the supraspinatus, and the infraspinatus. And that's the end of that one. So let's move on to another one. Muscles that act on the forearm. So we talked about the upper arm. Now we're going to look at the lower arm and the forearm. Your forearm is comprised of two bones, the radius and the ulna. Movement of the forearm occurs at the elbow joint. So elbows going to be very important in this one. On the anterior side of the forearm, we have the biceps brachii, the brachialis, the brachioradialis, and the pronator teres. And on the back side, you have the triceps brachii. So let's get into that. Your biceps brachii flexes the arm at the elbow joint. So go ahead and flex your bicep. That is your biceps brachii. It supinates the forearm and hand at the elbow. Its origin Well, there are two heads. The first head attaches to the tuberosity above the glenoid cavity of the scapula, and the other head attaches on the coracoid process of the scapula. And the insertion point for them are the radial tuberosity on the medial side of radius, okay? And the brachialis flexes the arm at the elbow joint. And that origin is at the anterior distal end of the humerus. It's a little lower down on your arm. The insertion is at the tuberosity of the ulna, right there. And the brachioradialis flexes the arm at the elbow joint. Its origin is at the lateral supracondylar ridge of the humerus, and the insertion is the styloid process of radius. So think radialis, radius for the insertion. Pronator teres pronates the forearm at the elbow joint, so pronator pronates. The origin, there are two heads here as well. The first head attaches to the medial epicondyle of humerus. The other head attaches to the medial side of the coronoid process of ulna. Middle of lateral surface of radius is the insertion point. And then on the back side of your arm, we have the triceps brachii. And that performs the opposite action. It's extending the elbow joint. So these are antagonistic muscles. Remember that. Its origin in the triceps, think three heads. The first head attaches to the tuberosity below the glenoid cavity of the scapula. The second on the lateral surface of the humerus. The third to the medial surface of humerus. And the insertion point is the olecranon process of ulna. Olecranon process of ulna. The movements of the forearm at the elbow joint include flexion, bending the joint, extension, extending the joint, supination, rotating the joint so the palm faces up, pronation, rotating the joint so the palm faces down. And we'll get some pictures here. So the flexion at the elbow joint is performed by your biceps brachii, the brachialis, and the brachioradialis. Extension at the elbow joint is performed by the triceps brachii. So if you're flexing your arm up towards your body, biceps are engaged. If you're extending your elbow joint, the triceps are engaged. Now turn your palm up. That is called supination at the elbow joint, and that's performed by the biceps brachii. Pronation, so have your palm facing up and then turn it over. That's called pronation, and that's performed by the Pronator Teres. The prime movers of the forearm include the biceps brachii, the brachialis, the brachioradialis, the Pronator Teres, and the triceps brachii. And that's it for the forearm. So we talked about the upper arm, where things originate at the scapula And then the insertion point would be the humerus. And then here, things are originating at the humerus, and then insertion points at the radius or the ulna, depending on the side of the arm. But hopefully you enjoyed learning about the arms, and I will see you all next time. Good luck and goodbye. See you next time.